Hi everybody, we are back with another episode of 11.5 Issues Live, 11.5 for Election Day, and of course we want to talk about the issues that are facing us for November 5th, the election. So today's episode we're going to talk a little bit about mental health. I'm really excited. I just came from an event that many of you all had heard about with an NBA star from the Boston Celtics, and we were hoping to promote physical health because it's all part of our broader point on the holistic health and well-being of children. When we think about developing not only their academic abilities, of course, to stay competitive and to prepare them for the future, but also their social, emotional well-being and to make sure that we provide their mental health supports. And being active and fit is one of the ways that we can actually promote mental health. So we were really pleased to be able to provide that for kids today. Thinking about Fairfax County and the condition of mental health in our schools, I can't emphasize enough how important this has been of an issue coming up with almost every student I've spoken with. It is easily the number one topic that has been brought up that children and students in our schools have been asking me to address. So, what's the condition? Right now in Virginia, actually after the recession, at the time when it was Governor Tim Kaine, had made a decision to cut substantially the funding for support staff in our schools. As a result, we will have $10 million less in support funding than we could have had in the future. So step one, of course, in thinking ahead is making sure we continue to work with our friends in Richmond to reverse that policy and to make sure that we can have that the funding to provide the services as we properly should. In addition, in Fairfax County, the Board of Supervisors has addressed the issue with something called the Community Services Board. The Community Services Board is appointees across the county, and their job is to provide certain services in urgent situations. They provide critical needs now, so if anyone is suicidal or has some severe challenges, they provide some of those free services and connect them to clinics and health services they need. So that's the state. We have our county government. We also obviously have our school system. It's critical to think about mental health because it actually impacts student performance. It influences the students' their trajectory in terms of whether they get involved with the discipline process and get into trouble. It influences their how likely they are, and significantly so, to engage in risky behavior and to develop negative habits that go with them. So it's certainly a priority for us when we think about student performance as well. And we want to make sure we support our students to have them develop positive, healthy habits for the future. As our condition currently stands, the Fairfax County Public School System puts out a youth survey every year to see what the condition of children is. And right now, we actually have reports of about a third of our students suffering from depression. 15% of our young people are suicidal or have been in the past, have thought of suicide. And of course, we know that these are significantly underreported numbers because students don't always want to admit. Some students don't take the survey. It is voluntary. So we want to really make sure that we address these challenges. When we think of the things that do affect students, there's of course stress, which is at significant levels higher than depression actually, with about 36% being reported. Anxiety is another factor, depression as we mentioned, a combination of all of the above and so many other conditions that students may go through that can affect their performance. So it matters to us from a student achievement perspective. In addition to, this is kind of the landscape of what's going on. Our school system has attempted to address it, and it is the most direct way and opportunity for us to address it. But we still obviously have a lot more work to do. Right now, we have a wellness policy in Fairfax County Public Schools where we, in terms of promoting our values, we certainly stand for ensuring everyone is taken care of, staff and students, and mental health is an aspect of that. We also have a part of our strategic plan which talks about a caring culture, and that also speaks to the importance of providing these supports and services to fulfill that strategic plan, which is one of the core objectives of the school system to begin with. And under that policy, we currently provide access to school psychologists that parents and students can schedule 45-minute consultations with in our various schools. So each school has an assigned help support staff person. And of course, there are also social workers in our schools. So we have our psychologists, we have our social workers, we have some parent liaisons as well, especially in the elementary schools, that can provide some of that support. Still, though, we're not doing enough and we can do better. So I'm really excited about reevaluating and looking at what some of the things we can improve on are. As it stands now, we actually fall behind the best practices when it comes to the ratios with these staff. So, for example, currently we have one counselor per several hundred students. The best practices are still several hundred, but much less than what we have today. We have about 250 is the best practices recommended range. We're closer to 300. When it comes to psychologists and social workers, it's much more drastic. For psychologists, we're more than 2% the times the recommended ratio. And when it comes to social workers, we're over 5% the times of the ratio that it should be. When you think of how many students a psychologist or a social worker can realistically and effectively keep up with and manage, we're nowhere near where we could be. And that's certainly something I want to fight for. And hopefully with some advocacy on the state level, we can get rid of the budget limitation that to be able to then provide those supports and incorporate them into our annual plan. Now, what else can we do? So one of the things the Board of Supervisors has recently put in place as a beginning initiative is actually a potential partnership with private practices across the county. That's an encouraging step. I want to see that expanded, and I want to continue pushing for that in the school system, both through public and private partnerships that'll allow us to provide these low-cost services to kids. We can also continue to incentivize campaigns in the schools through the student government associations and other clubs that can destigmatize mental health, because one of the biggest barriers is actually talking about it and feeling comfortable and open about seeking that help and not being ashamed for needing it. And a lot of our schools are highly competitive, and there's a stressful environment where sometimes parents don't even realize what's going on for a child, and they suffer silently, and that tends to be the majority of the cases. So we want to make sure we provide those services in a way that's super accessible. If we're able to put us on track with the budget to even have a partnership with private entities that provide applications on a student's phone, so that it's easy with a touch of a finger, they can receive that help that they so desperately need, and that they may be too shy or ashamed to talk about seeking. So that's another idea. Engaging students is also a critical component for safer schools, for more collaborative and healthier schools. Many years ago, my sister was actually a part of a peer mental health support group in Frost Middle School, and that was a pilot program, and it was very effective, and it's something we can implement across the county, where we have students be trained, which is something that it does happen across the country and is effective in places like Colorado and in other school systems, where students can access resources and trainings that prepare them to identify the signs of critical needs that their peers have. And oftentimes it is the students who know it best. They know when their friends are struggling, and they hear about these things in the halls and whatnot. So it's really important for us to have them be bystanders and to engage them, to be proactive bystanders in these circumstances. And supporting those kinds of initiatives will hopefully lead to better outcomes. There are so many other, ideas and things we can do to implement better mental health practices. We want to make sure we're following best practices across the country. There's the National Center for School Mental Health has provided a lot of good insight and has programs like SHAPE, the School Health Assessment Performance Evaluation System, where we can, in fact, put in place a process that not only provides services, but evaluates those services, assesses, and reorients us to do better in the future. These are all things we can do to address the mental health crisis that we have not only here but in our country. And it's particularly fitting that we're doing this right after National Suicide Awareness Week, which we wanted to make sure we shed a light on to start these conversations, to destigmatize the topic, because it's enough that we have students silently suffering, and we do know that in Fairfax County we've had a number of suicides in recent years because of just student stress and whatnot. And it's important to know that the data shows us suicides not only impact that child, of course, and we want to make sure we prevent it and remind them of their options, but that it impacts the entire school culture. And there are notable impacts on peers, friends, and everyone and it impacts the school climate broadly. So it is a public health concern for so many different reasons, with a far-reaching impact. I want to make sure we can be there for our kids. As I've mentioned from the beginning, we are advocating for the leader in every child. We are looking forward to making sure we empower every student, regardless of what's going on at home and the challenges that exist, to show them that they have a bright future ahead and that they can chase their dreams. And we're going to do our best to get there. Again, this is another episode of 11.5 Issues Live. Tune in next time, and we look forward to receiving your questions and comments, and send us some, of your ideas on what topics you'd like to hear about. So until next time, that's 11.5 Issues Live.